So, good morning, everyone. Today we have a very honorable Dr. Karam Sai Rai from Agarwal Eye Hospital in Andhra Pradesh. She is one of the most intelligent and wise doctor in Andhra Pradesh. Today we are talking about cataract. What is cataract? What is the impact in our life of cataract? So, please, ma'am, tell me what is exactly cataract.
Cataract is nothing but a opacification of the lens. That is normally eye is having a transparent lens which gives refractive power to the eye. So if it will be opacified in course of time or any trauma or sometimes from birth also the patient will have develops cataract.
Okay. So, ma'am, cataract is a genetic problem, or
Yeah, it is a hereditary problem, and most of the syndromes also associated with cataracts. So from birth onwards, the patient have a cataract either bilaterally or unilaterally.
okay. Ma'am, is it also depend on age? Age,
There is no age bar. The cataract can develop at any age,
any age.
from birth to till death.
Okay. Ma'am, is there any symptom of cataract?
Yeah, usually patient will complain of defective vision. So I'm not able to see less vision. Sometimes the patient is a driver.
Yes.
If the cataract is early cataract,
Yes.
the patient sometimes complains of glare during night driving most of the times. And some people they will say polyopia. That means he will see one image as many images. That is during the stage of incipient stage of cataract. The patient have those types of symptoms. Most of the times, the patient complains of defective vision. That is visionless vision. But it is gradually, vision loss is very gradual.
It's totally depend on our age.
When the patient have trauma, so traumatic cataract can develop within hours. So patient suddenly lost vision.
Okay. It's really effect on eyes. So, ma'am, is it prevented?
Yeah, some of the cataracts can be prevented. Now, I cannot say it is prevented, but it can be delayed. But most of the congenital cataracts, that means hereditary, you can prevent by doing consanguineous marriages. And some metabolic cataracts, you can postpone it. You can delay the cataracts. They're like diabetes and metabolic conditions like galactosemia, all fat storage diseases are some. That is mostly metabolic conditions that can be avoided by treating the causes. In case of galactosemia, you can treat the galactosemia. You can also reverse the cataract that is developed. That is usually seen in children.
Ma'am, is it depend on our body or something else to grow a cataract? Cataract.
Cataract growth, you cannot say. Some people have faster growth. Some people have the cataract will remain same for many years. So it is not depends upon the person, but it is depends upon the metabolic condition in the eye.
Okay. So, ma'am, those are suffering from cataract. So, how they treat?
Usually cataract should be removed.
Okay.
You have to remove and you have to replace the aphakia. You can replace by implanting the intraocular lens. That is artificial lens. You can implant it inside the eye
By surgery?
by surgery only.
So, is it safe for doing a surgery?
Yeah, it is safer only. Nowadays, modern instruments are there, modern equipment with high magnification. We are doing surgeries under microscope. And the latest phaco machines, we are doing surgery and with a small hole. And also femtosecond is also there. You can correctly you can do the surgery wherever you want.
It doesn't affect on their daily life when they are doing a surgery for cataract?
Usually, you can take rest first. Okay. 1 week to 15 days. Okay. If you do a cataract surgery. And if you got a phaco surgery with uneventful surgery, I mean, 1 week is enough. And they can go for routine activities after 2 weeks.
If after the surgery, cataract will come again?
After surgery, usually we are removing the cataract. Okay. So there is no, again, one more cataract. Because if you clean properly, thoroughly, without leaving any lens capsule or lens matter, it will not develop. But usually we will keep the posterior capsule to place the intraocular lens. So this posterior capsule can be thickened in the course of time producing posterior capsular opacification. To avoid this, thorough cleaning, one during surgery. Number two is using hydrophobic lenses. That will reduce or avoid the formation of posterior capsular opacification.
So, ma'am, you tell me about the latest advancement of cataract surgery. So, sometimes people don't understand. So, please tell us what is exactly latest advancement.
Nowadays, people also undergoing cataract surgery, not even cataract surgery, that is lens extraction, that is clear lens extraction they are doing, having high myopia and high hyperopia. None for doesn't want to glasses to wear. So that is but with the modern instruments, phaco surgery and femtosecond laser surgery, you can do it easily and without any complications. And you can give, and also you implanting the premium IOLs like trifocal, bifocal, and ADOF lenses. And the patient will have very good vision without any glasses.
Okay. So, ma'am, is there any other advice you want to give us to your patient or us?
Usually, if you have any regular ophthalmic checkups is needed because early cataracts cannot be seen, only seen by the ophthalmologist.
Sometimes
If you have any glare, any type of symptoms, if you get it, you go and have a checkup with an ophthalmologist. And if there is, and avoid, if a patient is a diabetic, regular screening is more important. And also any other, some other problems also. For a child, especially at birth, have a checkup. After 6 months, and another checkup. And before going to school, have a checkup. Like that, you have to see whether for any cataract, not even cataract, any other refractive errors, any other ocular problems you can made out. Because especially in children, intraocular abnormalities can be developed. We don't know. Mother also can know that the patient is having retina, choroidal coloboma, like that. If you have a checkup with a doctor, you can they made it, they will give the correct treatment. Because in children, if you delay the treatment, the child will develop amblyopia. So treating amblyopia in a child is a very difficult.
Definitely. So thank you so much. Give me a very good point about cataract, and thank you so much coming here. And stay healthy, stay blessed, and stay take care of your eyes. Thank you, ma'am.
Okay. Thank you.